Thanks a lot for joining us. I'm Mariam Zakut, a PhD student at Leeds University and also one of the organizers for this year's Sanitation Workers Forum. And yes, happy today to share this very, very interesting thematic session about the occupational health and safety of sanitation workers. And we have a great set of panelists to join us and talk to us about their research and work experience related to occupational health and safety. We have a set of various different contributions related to social enterprises, contribution to sanitation workers, lots to say about container-based sanitation and its relationship with occupational health and safety, policies, and all this mixture. I'm really excited about this session, not because it's not only talking about the technical aspect of occupational health and safety, because we've been talking about this since we started the whole sanitation workers challenges, but because it also try to tackle the policy aspect of implementing and empowering more access to better occupational health and safety for sanitation workers. So yes, we start today with our colleague from Oregon State University in the United States, Froggi, and she will be talking to us about the container-based sanitation in Haiti, the implications of service expansion on labor and exposure of sanitation workers. So Froggi, floor is yours.
Thank you so much, Mariam. I'm going to go ahead and share my screen here real quick. There we go. The work that I'm going to be talking about is work that I did with colleagues from the University of Oregon, Soil in Haiti, and Oregon State University. And we spent time down in Haiti doing a really intense user study of the users of the Eco-Lakai container-based sanitation system. And this is to give you a really quick introduction to it. The Eco-Lakai program provides this portable container-based toilet to household subscribers for private household sanitation. They supply a dry cover material on a weekly basis and exchange the containers of excreta for containers of fresh cover material. Then go through this service chain you see here, this cycle of collection, transfer, treatment into a safe compost product, which can then be marketed. Now this, you can see it's a urine diverting toilet so that it minimizes the amount of solid material that's being collected and treated, and the relatively low pathogen load of urine makes it safe for users to dispose of in the community or in the natural environment. And we are, of course, location-wise, we're talking about Haiti. Where we did our research was in Cap Haitian in the north. When we went through and we interviewed households up here who were users of this service, this is sort of comparing the World Health Organization Sanitation Ladder to the options that were available besides the Eco-Lakai service to households in this area. And there was a small number of households that did in fact have access to a private toilet of some sort, a latrine or a flush toilet. However, none of those were attached to any form of treatment in Cap Haitian. There's not yet a treatment facility. A lot of folks, however, had no facilities whatsoever or unimproved facilities. So this is just to give a sense for the kinds of responses we got when we asked people where they did their business before they had access to the Eco-Lakai toilet. But what was really interesting, what's relevant to what we're talking about today, is what we discovered. Sorry, this is just our graphical abstract, so it's a bit overwhelming. But what's really important is what's over here on the right-hand side, and that is that the majority of folks living in the more informal communities and the low infrastructure areas have some form of latrine if they have anything at all. And those latrines are in the floodplain and they regularly back up on land. But even if they don't, they're well outside of the accessible range of pump trucks. Even if trucks could get there, the nature of the sludge is difficult to deal with. And so, as we've seen in a lot of these other places, the primary method of dealing with this is manual excavation. So we studied, based on all the local data, the volume of excreta produced, the labor sort of economy of the Eko-Lakai toilet, taking into account increases in efficiency with scale, and basically came up with these calculations that to look into what the container-based sanitation implications could be if we extended it to a broader community, because it has now 12 good solid years of success behind the program, and the government is starting to really recognize it as a viable part of the sanitation portfolio in Haiti. And so, because as you saw back in that sanitation service chain, there is safe handling of this excreta. It's fully containerized. It is it's transported by workers who are provided with safety equipment, vaccines, health checks, and not working under cover of darkness, and not working through middlemen, and not lacking the equipment they need to keep themselves safe. It's obviously a significantly more dignified and safe form of employment. And so if we were to just extend CBS to homes that didn't previously have access to sanitation, it would bring 53,000 people into safely managed sanitation, and it would create 100 new excreta handling livelihoods. But if we just were even to replace latrines, convert households using latrines over to a container-based service like Eko-Lakai, we could be looking at 41 or 42,000 exposure events per year for sanitation professionals that would be avoided in place of professionals handling safely containerized excreta. And that's 833,000 hours of exposure. And interestingly enough, the container-based sanitation appears to, because it's better paying and it's safer, create twice the livelihood opportunity for the same number of potential households at only 1.2 times the amount of labor that would be needed to provide this. So I'm going to go ahead and stop sharing my slides and turn it back to the rest of you all. Let's see. There we go. Did I stop?
Yes.
Okay.
Wonderful, Froggi. Thanks a lot. And yeah, great timing. I'm definitely excited to ask lots of questions about this afterwards, because I currently look at container-based sanitation and definitely want to know more about the financial aspect of this and how it's impacting, of course, sanitation workers. So thanks a lot for this presentation. Very, very interesting. Up to our next panelist, we have Bruce from Vidura, a social enterprise in Rwanda, and he'll be talking to us about how social enterprise is contributing to better health and well-being of sanitation workers. So yeah, please go on. Wonderful, Bruce.
Thank you. First of all, thanks for all the attendees. It's a pleasure also to be here. So I'm going to present Vidura's work toward improving sanitation worker health and safety. So Vidura is a social enterprise that delivers sanitation services and we try to improve health and safety for our workers in Kigali, Rwanda. To date, like Kigali has no sewers, and 60% of the population reside in informal settlement where it's hard to reach, like so many other fast-growing cities. So in those areas, the fecal sludge collection and transportation is done by conventional vacuuming trucks. But for the community living in those informal settlements, those services are somehow expensive, and in other cases, they can't even work in those conditions because of lack of access. And yeah. So this leaves them with the option of using manual MTRs, which is kind of illegal. And due to this makes the manual MTRs work in not a good condition and end up like being marginalized and forced to work in those conditions that are inhumane. So also when they excavate those fecal sludge, they end up disposing them in the trenches, open trenches, and also, or maybe in another digged pit on site. So this doesn't only put their life in risk, but also put the risk of the community, the health of the community in risk as well. Okay. So at Vidura, what we do, so we train those sanitation workers, and we equip them with tools so that they can work in informal ways. And so far, what we have done, like we have already 7 manual MTRs that were before working informally, that now we have transitioned to formal economy, and they are proud of the work they are doing with the equipment and protection safely. So we give them we have a truck, and we also give them like a pump that can be transported in areas where the truck cannot reach, so that they can pump into the small barrels that the picture shows. Okay. So not only that, but Vidura has had a research collaboration related to improving sanitation workers, health and safety with Dr. Rachel Sklar from University of California, who's also a Vidura co-founder. So the research aimed at understanding workers' exposure to pathogens along the fecal sludge management value chain from the on-site facility, transportation up to the treatment, and also disposal, safe disposal afterwards. So, so they used a quantitative microbial risk assessment framework to estimate health risks to workers. This one, the good thing about this research is one of the first set of peer-reviewed papers to quantify health risk and put a number on the risk to invisible population of sanitation workers. And during this process, the workers got involved in understanding their exposure, the source of the exposure, and how to prevent them, and understand how they work, not only them at risk, but how they can also improve their protection so that they work safely in those conditions. Yeah. So, yeah. Another part of Vidura, so we have a research and development department that is fully like influenced or worked on by workers. So part of it, we have some ongoing work-led efforts that includes this first one, which is a system that helps pumping in hard-to-reach area, and we call it a DUVAC. So it's the transportable vacuum pump is taken to a place and then can pump, then the truck can pull from there. And this helps them reduce the task of carrying the barrel a long way. So the second worker-led effort is related to the barrel transportation. In many areas, we have seen that sometimes it's necessary to use 2 people, or sometimes you take the barrels in 2 hands or put it on their shoulder, which makes the work somehow risky and more intensive, and can also end up in contaminating the environment where they are working. So in this project, we tried to develop a backpack that we called a poop pack, so that the employees can carry the barrows on their back, and we try to meet the occupational safety and health administration standards so that we reduce the risk of injury related to carrying and lifting. And yeah, it also increase the stability of the load transportation. Okay. And another third work that we are working on, like if you have seen in so many areas when we are emptying pit latrines, we need to do the trash fishing, which consists of removing the solid waste inside the pit. And this task results, sometimes it's risky because the employees they can find like sharp metals. And so we are trying to improve that process. So I can show you a video how it's normally done. Can you see the video?
We're running out of time, so if you have a link to put it on the chat, it would be good. Oh yeah, here it is. All right. Yeah, we can see it.
So this is how it's normally done, but we are working on a project where we will be using a drill so that the employees don't need to work that hard to remove the trash. Okay, so first I will put the link in the and show you. Can you see the new video now?
Yes.
Yeah. So it's still an ongoing project where we'll be trying to remove them without hard working and removing. So finally, one thing I wanted to share, which is more important, is like the feedback that we get from the employees that we helped transition into the formal economy. So this is one of our employees who used to be a manual emptiers, and what they liked about our work is that now they are protected and they are proud of the work that they do, and also increase the income they're now making because they can, they are now working once. They used to work once or twice in a week, but now they have a steady income because of professionalizing the work. Now they can work during daytime, not necessarily working in middle of the night to hide. Yeah. So thank you. That's the end of my presentation.
Thanks, Bruce. Yeah, it's really impressive work and definitely have lots of questions to ask, and I'm sure the audience as well are really keen to know more about it. If you can stop sharing your screen. Up next, we have Pippa Scott, a World Bank consultant, and she'll be presenting to us more about the Sanitation Worker Initiative by the World Bank and other partners, and specifically about occupational health and technology gaps.
Thank you, Mariam. And it's such a pleasure to be presenting on this platform and in this forum today. So yes, I am presenting a review of technology and equipment that protect the health, safety, and dignity of sanitation workers. It's part of the World Bank's contribution, this segment led by Awa Jiang, towards the Sanitation Worker Initiative. Oh, and it's not advancing my slides. There we go. Just to kind of, as a high level, the way we did this review was using the hierarchy of controls pyramid, which was developed by the National Institute for Occupational Health and Safety in America, but it is endorsed by the International Labour Organization as a kind of really systematic framework for workers, all kind of workers, to understand hazards and then try and figure out how controls can be put in place to control those various hazards. And essentially you work down from the top of the triangle where you try and eliminate, substitute or put in engineering controls. And a lot of those are around technology to control the hazard. And then you can also work to change the way people work, which Rosie will be speaking to a little bit after me, I think. and then also PPE. And just to point out that in this scope, PPE is considered the least effective hazard control mechanism. So we looked at a wide range of technologies. I'm not going to go into how we did it and what we did in these 5 minutes. There is a report coming out, so the detail will be in there. But essentially, we identified all the hazards that sanitation workers face across the kind of different types of sanitation work, the value chain, also sewer workers, and then the different types of hazards. So there's chemical, biological, physical hazards, ergonomic hazards, and also psychosocial. So we kind of looked, breadth and scope. And what I want to present today is the kind of the 5 kind of top areas where there's a technology gap and a real need for technology innovation to help sanitation workers. And the first one of those is around confined space entry. Confined spaces are recognized. So in the context of sanitation, that's either a pit or a tank or a sewer manhole or a sewer, or in a treatment center, a kind of confined space where you're working, in a confined space. But the hazards associated with that are toxic gases, depletion of oxygen, or also engulfment by the material that's in that tank or in that process. So in sewage, that could be water, or it could be that the pit collapses. And these are we know that this happens to sanitation workers, but confined spaces are acknowledged across a whole host of industries as really dangerous and hazardous places to work. And there's a huge amount of work that's been done to try and kind of cater for this hazard. There's also this issue of a rescuer problem with confined spaces. And we know this in sanitation work, that one worker may go into a confined space and fall unconscious or get into some kind of difficulty, and a colleague will go in and try and help. And looking at reports from the 70s in the United States and 2019 data from what was reported from sanitation workers in India, it's between 40 and 60% of all sanitation worker deaths, all confined worker deaths are rescuer deaths. So there's a huge part of this dynamic is really, really important to bring into mind. So technologies that stop people getting into confined spaces and sanitation is huge. And I have to say, container-based sanitation is also in the report, and it's not in here. But there are different tools of this. So from the most basic, where you'll have seen examples of this, of long-handed fishing tools. Bruce had one there. A long-handed fishing tool, long-handed shovels, anything that stops the worker actually getting in. Mechanized pumps, you'll have heard about them. The gulper, poo-poo pumps, quite an impressive one because it ticks a lot of boxes. Hydrojetting machinery, that's used globally to clear blockages. So it's really high pressurized water jets that can be mounted essentially onto any kind of vehicle. And the example here is a narrow vehicle developed specifically for the streets in Hyderabad. And you will have heard as well of the Bandicoot robot that was developed specifically to prevent kind of sewage worker manhole deaths. And that's a very expensive piece of equipment, but also is designed to stop workers going into the pit. These technologies, a lot of them are stuck in prototype stages. A lot of them, they're not necessarily getting out to the market. It's difficult to compare them. And they're still not readily available for worker entrepreneurs necessarily, or councils, municipal councils, to kind of off the shelf buy one and get the information they need. So this is a huge kind of area that we need to keep pushing in technologies that protect key hazards for sanitation workers. The next one, and it was amazing to see these examples ahead of me, so thank you for setting up my pitch perfectly, is technologies that reduce the frequency and length of time that sanitation workers are exposed to microbial hazards. Microbial hazards are inherent in sanitation work. We can't eliminate them, so we have to find ways that we can control them. And there are easy ways, or there are ways that, you know, not that complicated, that we can address them. So putting lids on containers, this pigging tool, which is a foam cylindrical tool developed by the poo-poo pump guys from Practica Foundation, is a dedicated tool made for when there's a blockage in the pipe, because there's always blockages in the pipe. So rather than having the workers having to go in and fix it, there's a piece of equipment that reduces the microbial context. And then also kind of just reducing the number of connections, reducing the amount of time that the workers are going to be very close in dealing with sanitation, or areas there where we can reduce microbial hazards. The third one is physical hazards. Physical hazards are often overlooked, I think, in sanitation work. It was great, Bruce, to see this example of you know, some innovation around carrying. It's heavy. Some manual, you know, some of the manual work associated with emptying and carrying is really, really difficult work. And in context where of very hot temperatures, heat stress isn't just an uncomfortable situation. Heat stress is an acknowledged risk to life. So once the wet bulb temperature, which isn't the same as the normal air temperature, but there's a specific measure, once the wet bulb temperature gets to 35 degrees Celsius, we're hitting the limit of what humans can survive. Manual labor, clothing, no breaks, all of that can really exacerbate heat stress, and heat stress can impair cognitive function. It can cause mistakes, accidents, things like that. So again, there's a lot of work around heat stress, but it's just not something that we acknowledge necessarily in sanitation work. And from the map that you can see there, the really, really deep red spots are places where we've overstepped the wet bulb temperature of 35 degrees. And these places may be getting hotter with climate change. So just technologies that can reduce the load of lifting and reduce the load of conveyance are really, really places that we need to innovate and develop further. A point on PPE. PPE is challenging. It is not unique to sanitation. It's common, there's a lot of literature on this, and there are likely shared solutions out there as well. PPE is not a list of gloves, boots, overalls, masks. It's not a list of that. It's about comfort, it's about wearability, it's if you can get hold of it in the market, and is it actually applicable to the kind of hazards that are relevant for the specific task that sanitation worker is doing in place. PPE is also not clothing or only clothing. It's personal protective equipment, which includes clothing, but it also includes stuff like gas detectors and harnesses. And you can get a gas detector, or you can get a cheap one for $50. You can get a very good one for kind of 400, something like that, which would save lives of when someone's going into a confined space and there's toxic gas, it will detect the toxic gas and alert the worker. So there are other elements to PPE that are out there that we need to kind of bring into the conversation. PPE isn't considered in the hazard control framework effective at controlling exposure to hazards. It's very much a last resort. And so sometimes technology or regulation or, you know, training are put on the same platform as PPE. And I think it's just interesting to recognize there's a hierarchy in how strong those controls can be. It's not a one-off purchase. It needs appropriate storage, it needs training, it needs enforcement processes to make sure people are using them. And it's difficult to manage. And that's kind of globally, you know, around the world as well. SMEs and small businesses find PPE to manage even when it's available and, you know, accessible and affordable off the shelf. So it is more kind of complicated than that. And often the cost of PPE has to date been externalized. So we're having to kind of bring in not only the products themselves, but the training and the oversight behind it. We're having to kind of integrate that into budgets as well. And then a final point on a gap. And there was one example that we found in South Africa, but welfare stations for sanitation workers. We hear this is about kind of reducing the impact of once an exposure has taken place. We often hear about health insurance and stuff like that for sanitation workers, but another way to mitigate exposure is around welfare facilities. showers, toilets, somewhere they can change their clothes, and somewhere they can hang up their PPE, because that's how you can maintain your PPE so it doesn't develop defects. So there's a lot of it's kind of linked together. So very, very quickly, the work identified priority hazard areas for sanitation workers. We identified these gaps in technological innovation and the kind of high level ways forward. And I love Wilson's comment on the first aid, that everyone's got a different role. I think how these kind of pan out more detailed is you know, it would be great to hear kind of others weigh in on this as well. But absolutely, there's a real need to bring imported and locally developed technologies to the market. They need to be readily available on the market. We need homegrown innovation and development hubs. It's amazing to see Vidura's kind of contribution into that space as well, but that's where the innovation and the R&D really needs to happen. And all of this needs to happen. Technology innovation doesn't happen without wider, safer systems for sanitation workers, stronger regulation, a culture of safety around sanitation work. Thank you.
Thanks, Pippa. Yes, definitely interesting, yeah, review of all the different available ways to minimize occupational hazard to sanitation workers. Yeah, lots of things. I think a little bit controversial. Not everyone agrees on the high tech technology, and I'm one of those, so we'll probably have a nice discussion at the end. And yeah, for now, let's move to our next speaker. We have Rosie Ronoff. She's also an independent consultant, and she will be talking to us about policies, laws, regulations, and other instruments to support safe sanitation. And yeah, more about review and good practices of laws and regulations related to sanitation workers' well-being. So, Rosie.
Hi. Sorry, I can't share my screen for some technical reasons, but if you wouldn't mind taking the wheel on the presentation.
Yes. Sally, are you around? Wonderful.
Perfect. Thank you so much.
So if we can just keep a track of time,
Of course.
5 minutes, please.
Okay, so as already mentioned, my name is Rose Reneth. I just want to say thank you so much for the invitation. This is a really great opportunity for everyone to get together and talk about these issues. So thank you so much. I'll be talking today about the work that I've been doing as part of the Initiative for Sanitation Workers, again, similar to Pippa, under the World Bank auspice in that particular programme. So I've been focusing on occupational health and safety instruments in the urban sanitation sector. So that's primarily a review. So I've been finding lots of different examples of OHS instruments, and I'll go into what those are very soon. So these instruments that have been produced by international bodies, governments of all levels, WASH organisations, and of course sanitation service providers themselves. And the reason I'm doing this is because in order to help others and of course themselves to produce OHS tools that actually change sanitation workers' lives the better, the Initiative for Sanitation Workers really need to see what's already out there, how these instruments are working, what kind of gaps in the OHS framework workers may be falling through. Next slide, please. Thank you. So just a very quick primer on OHS instruments. If you could just click a few times, there's some, thank you. Perfect, that's it. So again, just a very quick primer. So OHS instruments include things like legislation. So that could be Health and Safety at Work Acts, it could be city ordinances or bylaws on sanitation services. It includes policies, so city FSM policies, for example, or a utility may have a health and safety policy, or well, ideally would have a health and safety policy. Regulations, so these could include regulations about transporting hazardous waste, disposing of treated end products or reuse of end products. Includes operating instruments, so these could be things like standard operating procedures, training for workers at FSTPs, for example, and standards. So these could include things like building codes for new houses that actually are supposed to have accessible or emptyable pit latrines or septic tanks. The reason these instruments are important is because as Pippa mentioned earlier, they form part of this hierarchy of controls. I mean, fairly lower down, so I mean, slightly less, well, effective at removing hazards as other controls, but they're still very much part of that triangle. They also form the basis of the enabling environment for sanitation workers' health and safety. So really that's really trying to get to grips with who's actually supposed to be doing what and to what stands as safety. So this is really the framework for actually making sure that sanitation workers operating in an environment where lots of people know their roles, they know what they're supposed to be doing, and all of these different aspects of protecting sanitation workers' health and safety are within a very clear, defined framework. Next slide, please. Thank you. Oh, perfect. So part of the work I've been doing is designing a framework with which to map these OHS instruments along the sanitation chain. So for example, this is the framework on the screen is obviously the framework that's been designed. So this is looking at the type of sanitation workers along the top, and then along the left-hand side of the framework is the type of OHS instrument. So the idea is that organizations or governments or whoever really can use this to map what kind of OHS instruments are applicable in different geographical contexts. And using this, you can really see where gaps may be emerging or may be very obvious in quite an easy to see way. And I just wanted to note here that the framework is useful for, I mean, very obviously mapping OHS instruments, but really that mapping should just be the first phase. You really can't assume that just because an OHS instrument, so for example, a policy exists, or for example, an FSM policy exists, that doesn't really mean necessarily that it's definitely being implemented properly or at all, or that that instrument is actually helpful for sanitation workers. Next slide, please. My computer logged me out. Great. So really quickly, I just want to go into some broad guiding principles for the people who will be assessing existing OHS instruments, or perhaps designing new ones or updating existing OHS instruments. So first principles is very, I mean, a lot of these are very obvious, but I think it's just worth saying. Do no harm. So for example, don't focus on leaping forward to mechanized services or mechanization of emptying services when, for example, there could well be an awful lot of manual emptiers who are very unlikely to be disappearing from the ecosystem in a city sanitation market for many years. Those manual emptiers who are already in existence will need protection and legal protection as well. So don't move too far ahead and accidentally essentially skip over the people who are already working in sanitation in a given city. If you could click, thank you. So account for differences and intersectionalities. Again, it's fairly obvious. These could be, for example, physical differences, so designing PPE for different kinds of body types. It could also include other aspects like religion, ethnicities, gender, that even within the kind of very broad, it's a very broad grouping to talk about sanitation workers, but obviously there'll be lots and lots of differences between and inside that group. So really trying to account for who is actually being helped by particular OHS instruments is really important. And this is a particular step to really try and analyze who is perhaps being seen as the standard, for example, and actually are there other people who are being left out or aren't being included because, you know, maybe they're less prioritized even within a group of sanitation workers. If you could click, thank you. Again, pretty obvious, take a multi-stakeholder approach. So that's not just involving as many sanitation workers or sanitation stakeholders as possible at various points of design process. It's also about potentially, for example, inviting in the private sector who would be for example, producing PPE or developing technologies. It could be also including the health ministry, for example, or labour bodies. If you click. Thank you. And combine different types of barriers. So the barriers here, technical barriers, organizational barriers, and behavioral barriers. So essentially combining hardware and software, similar to the hierarchy of controls as already explained. If you could click. Thank you. And I mean, again, very obvious, but focus on outcomes for workers rather than inputs. Just designing and writing, for example, a standard operating procedure is all very well and good, but actually trying to assess how that is helping and how that has changed behaviours for workers and how that is impacting their actual work and their health and their safety is incredibly important. I think sometimes there might be maybe a slight focus on things that have been written down, but actually how that impacts actual practice is incredibly important. If you click. Thank you. Oh, and of course, I mean, it's really interesting as part of my reviews. Obviously, I've been looking at and for lots of different types of instruments, and I've been finding lots of examples, but I think it's really important to take a minute to try and really assess how that instrument fits in the wider, kind of how it fits in with other instruments, and how it fits in within the wider legal framework. So for example, if you're designing regulations, if those regulations are going to be enforced, they will need to have a legal backing. So there will need to be something else that is also in place in order for those regulations to be monitored, to be enforced effectively. So just trying to think about how all these different instruments within a given city or a given country can be or should be interacting is very important. If you could click. Thank you. And I mean, again, very much related, try and design instruments so that implementation is at the forefront of the design process. There are certainly ways of doing that. If you could click as well. Thank you. And again, account for enforcement, because that's going to be, that's really, in a lot of cases, that's the difference between paper and practice, between something sitting on a shelf and something actually being enforced. So when I'm saying account for enforcement, when something is being designed, really try and think about a very basic questions about who is supposed to actually be doing this, who is responsible for overseeing it, how often will this be monitored, how will that be budgeted for, who is supposed, can the general public be provided with a number to call if they're seeing that someone hasn't been given the correct, again, PPE or is operating in an unsafe way. Thank you. If you click. I can just, I'm not sure if I'll have time to run through this, but there are lots of very good case studies. Kampala in Uganda is one such one. A lot of state governments in India as well. I mean, feel free to ask me any questions. I think I'll probably skip through this bit because I don't think I have time, but perfect, thank you. And yeah, just next steps. So there'll be a report coming out, which will be going into a lot more about the framework for mapping, as well as these recommendations. That'll likely be early 2022 at this point. And then the next step from that will be consulting with practitioners, governments, workers, all these kind of stakeholders to actually assess what kind of tools for designing better OHS instruments could be useful for them. And then developing a lot more detailed templates, tools, guidance that can be used to actually design better and more effective OHS instruments. And I'll leave it there. Thank you very much.
Thank you, Rosie. Yeah, very, very insightful review, and yeah, be great to discuss it further and see how it goes into implementation with different countries and governments. Finally, we have Mbura from Washington State University, and she will be presenting to us the experience of Synergy in formalizing manual pretentiers in Kenya. So, Gatti, please, the floor is yours.
Hello, everyone. It's a pleasure to be here. My name is Mbura, and I'm a public health researcher. And I worked for Washington State University early in the year, and we did work on evaluating this program called Fresh program, and primarily to really understand any gaps and barriers and any recommendations that we can have for the program going forward. It's implemented by Synergy, so we worked alongside them to try and identify and understand the program that they have been implementing for a while. So proper sanitation services, as my fellow panelists have mentioned before, do play a fundamental role in improving people's health, dignity, and the local environment. And this program is actually based in Kwanjenga, and it's one of the largest informal settlements in Nairobi, holding about 300,000 people, and it's estimated about 60% of these people actually use pit latrines. Hence, you can see why manual pit emptying is a common and essential service in this area, because they, there's a lot of no sewage areas, and often the pathways are not easy to navigate, even for these vehicles or equipment, of which are often too expensive, even for the community to really rely on. And manual pit emptiers often face stigma from the community, as has been discussed before. And Fresh program aims to protect the safety of these MPEs and encourage safe practices as well as PPE usage. So this program was started in 2017, and they currently have 37 manual pit emptiers in 2 sites, in Kwanjenga and in Ruben. In the picture, as you can see on your left, is one of the central discharge points that actually holds up to 30,000 liters of waste. And this is just WSU staff going on the ground and seeing how everything works. And you've seen this in pictures earlier, but these are just what they call ambulances, which are used to carry waste in barrels from pit latrines to Synergy sites. And this is just a picture of manual pit emptiers transporting waste from one place to another. Most of these MPEs actually all were male, and they have worked, some have worked close to 30 years doing MPE work. Some have worked for as little as 2 years. So they vary, but they're all male. And they've really done a lot of work in terms of waste management in this particular area. So the way we did it, we focused on these 2 disposal sites in Kwanjenga and Ruben. Our participants were manual pit emptiers, the site managers in the 2 sites, and the program manager for Synergy. The design was a mixed method study, and we focused on ensuring that we have both quantitative and qualitative surveys. For quantitative, we focused on knowledge, attitude, and practice survey, and also focused on key informant interviews and focus group discussions. And I think my presentation is really going to speak to the voice of the manual pit emptiers and some of the barriers and gaps that are identified in this work. So I'll present some of the findings that I think are quite relevant. When we looked at waste discharge habits of MPEs and the reasons for perhaps preferring discharging in these sites, most did talk about that they used to really face a lot of issues in defending themselves, because like talked about by my fellow panelist Bruce, people essentially do work primarily at night. But formalization of this manual pit emptying work through Fresh has enabled them to actually do this work during the day. And as you can see, most people before Fresh were disposing their waste in nearby rivers, in manholes, in drainages, and by the roadside. So essentially, this has really improved environmental output of the manual pit emptiers work. In regards to PPE usage, which is a really contentious topic, a lot of manual pit emptiers did say that they use PPEs during their work, but there are often certain challenges. One of the participants says that you may touch the ambulance, but then if you don't put gloves, if you do put gloves, the metal is too slippery and often impractical to use. And also they are provided with goggles, for example, but they rarely use them. You can imagine under the Nairobi sun, it's quite hot. And if you're traversing kilometers, like 6 kilometers, it's really impractical to use some of these equipment for the manual pit emptiers, especially because they're not used to using these particular PPEs. Some of the challenges were also highlighted by the site manager. Again, they preferred using gloves during emptying, perhaps, but they did not necessarily use it during transportation and dislodging. And the mask, it was very hard to breathe inside, especially when you're pushing and pulling the ambulance. So sometimes it's impractical. Though there was improved usage of PPE as compared to before they joined the program, it is essentially important to do realize and note that it's actually very hard to implement the usage of this PPE. And it's very important because of the nature of the work to improve PPE usage. In terms of stigma, prior to joining them to Fresh, one of the participants said that they actually see them as thieves because they don't have dust coats, but when they see you in uniforms, they perceive you as a group. And beforehand, you could be easily mistaken as a thief who's going to steal. This speaks to some of the challenges that MPEs face. And to combat these challenges, Sanergy catalyzed the inception of a CBO with guided rules and regulations. So the MPEs actually sit and meet and discuss some of the rules and regulations that they have to adhere to as a group. And part of that is, not necessarily, for example, using alcohol while at work, which you can imagine because of the nature of the work, it's very easy to resort to alcohol, as can be seen by one of the quotes from the site manager at Kwanjenga, who said that they used to work while drunk. They were not really given respect. So once they were provided with PPE and they were made to look professional, the stigma often slowly got out of the way. And one of the site managers in the newer site said that if they're drunk, that's when they feel that they're their safest spot, and they feel safe they're drunk because they don't feel ashamed. And Sanergy basically was able to help these MPEs sit and make rules for themselves to ensure that, for example, if they don't adhere to certain rules, a fine is given upon them. And a lot of the participants really said that this assisted with the alcohol use and abuse and just the formalization of the work. And it actually helped in terms of ensuring that manual pit emptying work is done in a way that is potentially safer than how it was before. So some of the key takeaways of the work and the evaluation that we did is that, as discussed by my fellow panelists earlier, PPE is important, but obviously there needs to be continued sensitization and on usage. You can imagine for an MPE who's worked for 15 plus years without PPE, some of the data said that, like, I don't feel like I need MPEs, I'm still okay, and I've been doing this work for a while. So the continued need for sensitization is very important. Perhaps the program could think about replacing or potentially replacing damaged PPEs for the manual pit emptiers, and also maybe working with other organizations to identify PPEs for appropriate PPEs for manual pit emptying work, which I think has been discussed earlier. And then also, I think more community sensitization is needed to emphasize the importance of pit emptiers. I remember in attending one of the interviews, one of the participants says, you can imagine when you are actually transporting liquid sludge and waste across a business premise, you can imagine the stares and the looks that you get. It's very dehumanizing. So essentially, if we can also focus on adding to community sensitization, it will really go a long way for these manual pit emptiers. In terms of alcohol abuse, I think it's quite important to still work with MPEs to implement rules and protocol to deal with rule violation, and also work with programs that help to support the rehabilitation of alcohol usage. All in all, despite all these challenges, formalizing waste emptying through the TAFresh program. We have seen added benefits of this, including reduced stigmatization, ability to work during the day, as had been mentioned before, importance in rules and regulations, managing alcohol use while working, and essentially improving the attitudes of employees towards their own occupation, and they can feel proud of the work that they do because it is very important. In conclusion, the TAFresh program serves as a good example in the importance of the provision of adequate and safe sanitation, which ultimately supports both human and environmental health. And in conclusion, I just want to thank all the study participants, the MPEs and the Sanergy staff, which made this evaluation very easy. All my colleagues at WSU, which I think some of them are actually part of the people that I've joined in today, my colleagues at CDC, as well as Sanergy. Thank you.
Thanks, Gatti. Thanks for this presentation, really insightful remarks from the study. And now we'll start the discussion. So please, if you have any questions, feel free to post it on the chat or just unmute yourself and just hit around to our panelists. So until our attendants put some questions, I have one question for our first panelist, to Froggi. I'm really I'm trying a lot to understand more container-based sanitation, and from my small research during my PhD, I feel like it's a sort of expensive technology, and I was wondering how is your perception about how expensive this technology would impact the livelihood of sanitation workers in terms of their fee, of their salaries, and the sustainability of these types of toilets in general and its impact on sanitation workers.
Yeah, that's an excellent question. And there's recently been a study that came out in is either late 2020 or early this year by Ernst & Young, or EY, and that actually breaks down the true costs of producing of providing a container-based sanitation service against equivalent types of sanitation, whether that be pit latrine, and its life cycle cost, pit latrines, sewerage sanitation, semi-centralized and fully centralized. And economies of scale is one of the most important aspects there. Labor will always be, like you said, the #1 sort of cost in providing the service. But as you saw from the technology that I showed you a photo of in my first slide, it's a very, very low cost physical technology. So yes, the biggest bulk of the cost of providing service will always be in the labor. But where this is also the most needed, these low infrastructure areas are areas where there is a great deal of need for livelihoods, safe livelihoods and livelihoods in general, and where the cost of labor is relatively benign compared to areas where more technologically advanced approaches are more appropriate. And of course, when I say that, it's important that the value of the labor is being paid adequately, right? It's not about trying to get the cheapest labor you can to provide a service, because that is part of the value of what's happening here, exactly why we're here talking today. But it is basically sort of the outcome of the Ernst & Young study, and what some of the insights that we've obtained through our work shows a lot of potential with economies of scale. At this moment, like I said, Echo Lakai is about 12 years into providing this service. It's got a really healthy history behind it of success. And we're just starting to see the government of Haiti engage in this in a more active way, looking at some outcomes-based financing, which will increase the capacity to provide this service throughout the community. And as that happens, we're going to watch the direct cost of providing the service go down more and more and more. And then a last and final thing is we're really not comparing apples to apples when you're talking about this in an area where pit latrines are overflowing every time it floods and where sewage sanitation isn't actually going to treatment. So the cost of providing that service to achieve safely managed sanitation, we don't have anything to compare it to at this point in time. It is the only way of achieving that given the infrastructure available. So That's my long rant.
I agree. I mean, yeah, it's a dilemma, I guess, between achieving safely managed and not paying a lot. So it's a continuous dilemma for all of us, I guess. Still no questions from the attendees, so I'll get going with more questions to my colleagues, and I also ask my co-chair to Amita, who's here with me, to propose some questions for the participant, for the panelist. Taking the same point of we have one question from Pippa actually. So Pippa, please feel free.
Thank you. It was just a comment back on the cost of container-based sanitation, and I agree. At the moment it is expensive, but just to point out, which is really exciting with the sanitation work, at the moment the container-based system internalizes these occupational health issues of sanitation workers. Those costs are brought in. They have good PPE. There's good equipment, and whereas at the moment all of these costs, we're getting a lot of very cheap, very free labor of sanitation workers at the moment that isn't reflected at the moment in emptying. And will it add up? How will it come out in the wash? We don't know, but I think that's something really important that we could keep an eye on, and just recognize that there are hidden costs that we're not yet quantifying in some and others. Thank you.
Thanks, Pippa, for the contribution. We have one question from Chada to Gatti. He says, great presentation on MataFresh project. The question is, what would be a better way to transport waste? Gatti, would you like to?
Yeah, thank you. Thank you so much for the question. I've never seen that idea of the one that you introduced, Bruce, of the backpack. You have to contextualize some of these spaces, actually. It would be very hard to say that it's going to be practical to have large equipments that are, going into these spaces. So sometimes it just requires a bit of innovation in some of the equipments that are used. In the meantime, we're talking practically. Hopefully in the near future, we can implement some of the technologies that we've seen here today. But at the moment, and dealing with situations now, we have to think about it practically. Number one, it's the landlords paying for this fee, first of all. So when you introduce equipments in these areas already, like it's a low income area, you don't want to necessarily add on to the economic burden that is already being faced. So practically, I think it's just like solutions similar to the one that Bruce presented for the meantime, as we figure out how to improve the sanitation in these particular areas. Thank you. I hope I've answered your question.
Thanks, Gatti. Any more questions from, Amita? Amita, please go on.
Yeah, hi, great presentation, very interesting. I've got a question for you, Pippa, which is you mentioned the barriers to expanding the access to PPE and safety equipment across the market. Is there any indication of how we can actually overcome this barrier in the longer term? Where do the solutions come from? Is it got to be a bottom-up approach of enterprise and people developing their own solutions, or does it need bigger top-down? How do we get around? Big question.
No, and it's a good question, and I dodged answering that one in the report. I think so why hasn't technology got to market? I think a big question of that is literally like the technologies that have been developed and then not actually gone the last mile to get them through that final kind of iterate, which is hundreds and hundreds of iterations to get them over the line. And they were being developed in the last, let's say 10, 15 years under this guise of sanitation as a business, where the bottom line had to balance. And I think there's a lot more people being brave now and saying this isn't going to balance. We need public finance, we need subsidy, someone's going to pay for it. But when these technologies were trying to be, like 10 years ago, it's been such a privilege to jump back into this and have a look what's there, because I was looking at it 10 years ago and it's like, oh, not much has changed. But 10 years ago, it was really like shit is cold, sanitation as a business, entrepreneurs, and we could make money from it. And I think that's changed. So that's one, acknowledging that we're going to need to really get the cost price down, but we might not get over the break-even point. And I also think innovation doesn't come from anywhere. Innovation does come from regulation, but at the moment there's very little incentive to innovate when workers' rights aren't protected. And that's a whole big, huge question. And that's not one we're going to fix overnight, and that's not one that's unique to sanitation. But I think it's really important to just recognize that if we've got cheap labor whose rights aren't protected, by promoting technology, we will always have a class that could be very, very vulnerable. So there's many reasons why it hasn't happened. I think there are ways that we can make it happen. And I think actually creating these kind of hubs where people can go and see and buy something and get after sales advice and have a look how it works and really create that knowledge more localized is a way forward. It's not an answer, but it's a much better answer than having it being developed in one country and trying to get the parts through customs, and it takes forever, and that's not going to be the solution. So I think, you know, the kind of stuff like Bruce was talking about, having these R&D things, and actually the learning and the rapid action learning groups, that's where innovation comes from.
I guess you've always got that here of try and buy for sanitation workers. The better ones are going to wearing this, using this equipment, wearing the PPE. What I'm getting is that it made some mechanisms that they can actually see if the PPE fits or if they can use their tools, and so they can in the market be able to the workers directly is what you're trying to.
Yeah, and I think we're closer to that now with having forums like this and having connections with sanitation workers and entrepreneurs that are now kind of surface and not as invisible and better organized. And so I think we're closer to that than we were 10 years ago. And I think there's there's more brains on it as well, and more brains closer to the problem, which is huge.
Thank you for making a very insightful discussion. And I've learned so much. Thank you. Mariam, back to you.
Yes, thanks, Amita and Pippa. This discussion that Amita has prompted is really driving me to ask the inequality question and its relationship to this innovation to occupational health and safety, in terms of the innovation in occupational health, but also the technology that we use to do the job. And from my small experience, it feels like that, keeping on imposing, or not imposing, but proposing technologies like vacuum tags, etc., increase the inequality gap between some people, and it makes it more of a money or financial question, if it's affordable, not if there's a subsidy for this or not. So I'm just wondering if all our panelists have some takes on how inequality can be bridged when we are looking and keep exploring this innovation aspect of sanitation workers' job. And Bruce, specifically, I would really like to hear from you more about the social enterprise and how it's funded or financed to and is able to continue offering this support to sanitation workers, and the criteria for including sanitation workers, etc. So please, if you have.
So thank you. As my colleague says, the biggest problem is like making this technology become affordable to those manual MTers. So sometimes when we develop technology, they're kind of expensive and they increase the cost, which makes the owner of those facilities not being able to pay for them. But one of the things that we have noticed during like most of the development, the project that we are working on, especially related to the trash fishing, especially, is that as when the customer is satisfied with the service and they somehow like feel like happy to pay maybe an additional cost because the service is done well. But yeah, of course, we have to, because we are focusing on serving the low income community, so we cannot charge them like the full price. So there are many like strategies to reduce the cost, like clustering, or I've seen in Gati's presentation, like they have a transfer station. So sometimes we want to also to mix many strategies to reduce the cost so that those new equipment, the cost of them can be covered, but can be covered by the income from serving the customer. But yeah, of course, there is still a gap. Like our R&D team is not fully like financed by our income from serving. So we try to. That's why we need like we need the subsidy from other stakeholders for sanitation so that we can still improve the sanitation and make it affordable and also safe so that everyone can work on it.
Thanks, Bruce. There's actually another question from Moita related to what you've said. It says, what long-term initiatives are being implemented by the government of Rwanda to address these sanitation issues? And where do you see synergies with the project that you have implemented that will create a more sustainable solution?
Come again?
Yeah, so just basically, what are the current efforts by the government of Rwanda to support sanitation in general and sanitation workers, and how this intersects with your work and how this would help your solution to be more sustainable?
Yeah, thank you. So, so far right now, like the help that we are getting from the government is that, okay, it's still, the government is still trying to work now with the private sector, but before everyone was like working on their own, serving everywhere. But now we have the government has tried to put to create an association of all the MTRs so that we can bring up our challenge and so they can see how they can support us, especially like in many other sectors like water and energy. There are sort of support from the government, and now that the government is putting MTRs together in a sort of association so that they can hear our issues and maybe try to help us together. And another thing is we have seen like during like community meetings, the government is trying to tell the people that doing the manual MTRs, like the former one, is not safe for them, and it started putting like regulation to forbid that, and this makes like the informal those manual MTRs come to us and try to get jobs so that they can work in a safe environment. And yeah, so I think so far that is like the first step that a government is doing, like the public sector is doing, so that yeah, it's sort of inclusion and including us so that yeah, we work together to bring the sanitation to the community very well.
Yes.
Did I answer the question?
Yes, I think. Thanks, Bruce. We have one comment / question from Vishwa One. I hope I've spelled it correctly. It says, are we trying to address an essentially, I think it's a question for all, or a comment for all. So are we trying to address an essentially socio-political problem as though it's a technological problem. It says the real root of the problem is lack of access to land, housing, and decent quality of life, collapse of the state. How can this be addressed by technology, and that too universally? A classic low level equilibrium trap being fostered on the poor in society. I definitely agree with this insight, but I guess at the moment what we can do is trying fixing some issues, but I totally agree that there's embedded challenges and social issues and political issues that need to be addressed. But I guess with more collaborative work and more involvement of the different stakeholders, the stigma related to this type of job will hopefully be minimized with time, and thus changing the scenario in terms of access, low access to land, housing, and equal opportunities to everyone, which is really, again, I totally agree, socio-political problem, caste problem, too many complicated social sciencey issues, and not the engineering part, the problem here. But we are trying to do. I think Pippa wants to add something.
Oh, or Pippa, I would love to add something if Pippa has something.
Yeah, definitely.
Oh, yes. Okay, me?
No.
Okay.
Yes.
Well, this brings up, I think, the topic that I keep going back to, which is citywide inclusive sanitation framework, which has been emerging, of recent years as a way of looking at how to achieve sanitation for all across a whole urban community. And it has a couple of base premises, and one is that it should be outcomes based. Everything should be about achieving sanitation for everybody, and not about technologies, and not measuring it in that way. And technologies may be a tool in getting there, but one of the other premises that you see referenced every time you're talking about citywide inclusive sanitation is that when we're talking about meeting a basic human need, there's never going to be a successful market-based solution to something that is a basic need for the least resourced members of the community. And so if as a community, if as a governance structure, the goal is to achieve safe sanitation for everybody in the community, then we actually would leapfrog over some of the challenges we were just talking about with exacerbating inequalities. So in other words, if the government was committed to ensuring that all latrines were safely emptied, or that container-based sanitation was provided to people with no infrastructure, then there would be jobs for people to walk into using the appropriate technologies, and they wouldn't be finding these illicit work opportunities in the informal sector. And so I go back to that a lot, that everybody in here is working on some element of trying to achieve this outcome. But if we all keep advocating for the citywide inclusive sanitation framework as the holistic outlook on how we're going to get where we need to get, then we might get there faster, hopefully.
Well, yes, definitely. I think there's different points of views and how people perceive this. I guess everyone from their own privileges, knowledges, experience, and all a mix of individual experience and how we perceive this issue. Thanks, Froggi, for the comment. Please, our panelists, if anyone wants to add into this, would be great to hear from you. And if you want to further discuss this topic or have other specific questions that you want to have to your fellow panelists, please also do so. At the moment,
just to piggyback on your comments, Froggi, I think definitely this problem needs to be looked at holistically, and also it's multifactorial. In Kenya, for example, we do have the Ministry of Water and Sanitation, but how often do they meet with these MPEs, CBOs, or stakeholders that are actually involved? And that often happens when we talk about equity, right? Like people who don't have a voice, of low income, essentially are the ones that do not benefit from state structure, even when there are policies and frameworks. So I think this is very important to think about. And I think once we really stop dehumanizing people of this particular sectors, I think is when we're really gonna see exactly why they're important. I know in Kenya, for example, there's a lot of informal settlements, and they really do have a huge role to play, not only in the social infrastructure, but also the economic infrastructure of Kenya, and hence it's very important. I do have to say one thing that I did in Advocacy Energy that I found to be very, very commendable is that in the pit site, they actually do have a place where the MPEs can wash up after work. Actually, when we were doing the focus group discussion, everybody was washed up and cleaned up. Everybody was looking fresh, and they were so happy to be part of that particular work. And they seek more pride and joy now that they are part of this work. So sort of like coercing efforts that surround MPEs, putting them at the focal point, I think will essentially help to stir up some of the burdens that we've seen before, and hopefully also change the social geopolitical climate of sanitation. Thank you.
Thanks, Katie. We have one question from Hova. From Diana to Getty. Do you think professionalization of MPEs will encourage women to join the profession?
Yes, thanks, Diana. That's a very good question. Again, that also speaks to the subject of equity. Manual pit emptying job, it's a bit hard to say that women will join, especially in the near future, just because of the labor intensity of it all. But with modernization of certain technologies, perhaps it's going to be easier. Already women steer clear from stigmatization that surrounds them in low-income areas, so it might be difficult, but the professionalization of it, I think, is definitely steering steps towards the right direction, that, hey, this is actually something that I can earn an income from. And if I may add, I think in Kenya, for example, just a very different example that I can think of, our public transportation matatu rides. Growing up, we call them matatus. We never used to see female conductors that actually are on these buses. But essentially, I think with time, with formalization, uniforms and things like that, now you see bus drivers, conductors that are women, and it's no longer abnormal to see such kind of things. So why can't we see more women in this job? I think women have a way to really make the community appreciate people more. So when you see women, you see that they're sort of, steering the good attitudes about the position. So I mean, I really hope to see that happening in the near future. But I do think it does help to steer it in that direction. Thanks, Dinah.
Thanks, Katie. We're about to close, but I know I should be just sharing, but I'm really excited about this topic. So I'll just have another question. Yesterday there was a session about sanitation histories and the colonial aspect of sanitation, and how we try to impose a sort of our perspective or our idea of success or solutions. And I've been always, of course, wanting to see more organized work, more professionalized work, and I know that the current scenario of non-professional work is witnessing lots of challenges and health issues and etc. But I've been talking to people in Kenya and so many other countries about the fact that being part of a collaborative or a cooperative would be beneficial or not, and lots of people talked about how being part of this professional union or not union, but a sort of private enterprise makes them lose the sort of financial income and not as good as beneficial as they work as informal. So this is a sort of a dilemma or a bargain between two elements, working in a sort of more dignified situation, or better or with less money, or more money and less dignified job. So yeah, I'm just a lot of questions or question marks related to the incentives of enterprises and the private sector, especially when they work with pit emptiers, and how they are they actually empowering them or just taking them to do this job? I was trying to write a blog about this, but I couldn't. So if you guys would please give more insights about the role of the private sector when we address occupational health and safety. Do they do this just because we want to look good as a private sector, or because we really care about sanitation workers? I know it's a sort of political, social sciencey question, but I'd really like to hear your insights.
My response to that, if I can just briefly, why not kill two birds with one stone? You can make money. For example, the waste that is being, put in these pit discharge sites can actually be done value addition. You can make money from that. Incorporate, social determinants of health that are helpful through the MP work. I don't think it's bad to want to build a business out of it, but if you're doing it in a proper way that dignifies the work that is being done, I personally don't see any issues with that. I know sometimes it's hard to balance the two, but I think it's quite important because once everybody loves money, once there's a money initiative, I think it helps. And especially if you can bring in that money and trickle it down to the people below and sort of everybody can enjoy from waste management. I mean, why not? I think it's a good thing.
Thanks, Katie. Good point. Definitely money. Money talks everywhere. Pippa, please do comment.
Hi, Mariam, and thank you for bringing up this point. As part of this report, with the looking at the NIOSH framework, so that's from the American occupational health structure, and I was like, okay, what's the history of occupational health? And literally ended up in a wormhole of where occupational health and worker rights comes from. And it comes from early industrialized countries after their industrial revolution, and these processes started coming in. So there is absolutely a kind of, there's a lot of work that's been done and it's good and it's helpful, but it also may not be. So there's this kind of dichotomy of, we don't need to reinvent the wheel. There's actually a lot that's out there, but it also might not be copy and paste. If it, like being really kind of cognizant of what those histories are and where it might be coming from, that there are, the ILO has some incredible resources and conventions that countries can sign up to, but they may not be relevant or they may be relevant. And I think it's just about that opt-in and seeing what's there and understanding where it comes from, understanding where the regulations come from. Like the work on confined space, there's so much work that's been done there, and it's a known risk. So we don't necessarily need to reinvent the wheel. It's not being applied yet to sanitation workers because when it was invented, this was completely invisible and we didn't talk about it. But also then if we are adopting it or we are borrowing it, to just kind of acknowledge also what we're adopting and do we need to tweak it? Do we need to rewrite it? All of those kind of questions. But yeah, I think there's a lot in there. But I think it doesn't necessarily have to follow the same trajectory as formalization, but I think it's like actually we are looking for better rights and protection of some really key essential workers in our societies.
Thanks, Pippa. Yeah, I agree. It's mostly Bruce, please go on. I mean, we have 2 minutes, but please go on.
So to wrap it up, I also agree with what Gati said. And also when you look at now sanitation becoming like a necessity, everyone is recognizing like it's necessary to have a safe place to go. And there is a demand that is increasing every day. And if we don't bring that solution that the people are willing to pay, that's when the manual MTRs will result to going into those unsafe practices. So yeah, the demand is there. So like now the private sector is trying to engage in it and bring up a solution that the customer is willing to pay because they are safe and they're happy about it rather than seeing someone going inside there. I feel like even those who are paying those guys, they always feel like they can't do it. It's not safe. Like, so if you propose them a better solution, I feel like, yeah, they are happy with the service. And that's why like the private sector is now getting more involved in developing this technology and twisting the solution so that it can be perceived nicely with it. Yeah, thank you.
Thanks, Bruce. Yeah, definitely the demand is driving more interest and more solutions to happen. We came to an end, so I want to thank our panelists today for their great presentations and very insightful notes, and also to my co-chair Amita and my tech support Sally, my colleagues from the Sanitation Forum committee. So thanks a lot for joining us today or tonight, depending on your location. And yeah, please do keep the conversation going, and see you in the other coming sessions of the forum. Yeah, have a good day.